So Kelli-Ann, can you talk about the types of services that are provided here at the clinic?
Our goal here at the clinic is to promote home dialysis for patients. So we'll educate sometimes patients who haven't been on dialysis yet about what their options might be if they want to be at home. If they've decided to do home dialysis, whether it be home hemodialysis or peritoneal dialysis, we'll teach them everything they need to know about doing their dialysis at home. And then once they are at home doing their dialysis, we're their resource. They call us if they have any problems. We call them if there's anything we need them to know. And they'll come here about every 3 months or so for a checkup with the multidisciplinary team. And they'll see a nurse and a dietitian and a social worker and a physician. And then when they're out there doing their dialysis at home, we're following their blood work. And hopefully we see them off to go get a transplant someday. So we'll follow them as long as we need to, and they're never really alone when they're at home doing their dialysis. There's always somebody to call if they have a problem or a concern.
Now you talked about two types of dialysis, peritoneal and hemodialysis. Can you talk about the differences between the two?
When your kidneys are working well, they're able to clear garbage or toxins out of your blood and also remove fluid from your body. And if your kidneys are no longer doing a good enough job with that, dialysis can help with that. So basically dialysis is a way to move some of the toxins from your blood and also fluid if it needs to be.
Right.
So hemodialysis would be a way to remove garbage and fluid from your body. By taking your blood and filtering it on a machine outside your body. And that's the type of dialysis most people are familiar with, where you go into a clinic and you're hooked up to a machine and the machine will take your blood out, circulate it through a filter and back to you. People doing hemodialysis typically in a clinic setting would go 3 or 4 times a week, and they'd be on their machine in the clinic for maybe about 4 hours of treatment. People at home doing their hemodialysis will have to spend 4 to 6 weeks learning how to do their own, but they're able to do it in their home either while they sleep, a little bit every day, or they can do it a few times a week. So they're able to kind of sort their schedule out themselves depending on what they need.
So it sounds like there might be a lot of benefits for many people to consider home dialysis, just, you just from the pure comfort and flexibility piece of being able to do it in your home.
Right. Studies would indicate that people do better when they're at home managing their own treatment. There's limitations, of course. Sometimes people need a little help at home. Sometimes people are living at home by themselves doing their own dialysis, but sometimes they also need a little bit of help. There's also peritoneal dialysis, and that is a way to filter the garbage and fluid out of your body using a filter inside your abdominal wall. It's called the peritoneal membrane, and it works a lot like the filter on the hemodialysis machines, but inside your body. And we can put fluid in your abdomen and let it do its job and drain it out after a period of time, and that way we can remove garbage and fluid from the body. And it doesn't take as long to learn that kind of dialysis. It's a little more basic, and people will come to the clinic here and learn how to do that dialysis themselves, usually over about a 4-day period of time.
Wow.
Yeah. And they'll learn a way to do that manually using some bags and a catheter that's placed in their abdomen to get the fluid in and out. And if they want to use a machine at nighttime while they sleep to do their peritoneal dialysis, we call that a cycler. And we have those machines here. We'll bring them back and teach them in about a day how to use the machine so they can do their dialysis while they're sleeping each night at home.
If you can do it while you're sleeping, that frees up your day.
It frees up your day. So you can imagine that you maybe be able to work, go to school, look after your grandchildren, do the sorts of things that you like to do during the day and do your dialysis overnight. So that a lot of people here in our clinic choose to do that.
As you were saying earlier, they get significant training and education in this clinic, which is a big part of what the clinic is doing.
We get to know our people very well. We support them as much as they need. Our goal is to keep people at home doing their dialysis as long as possible. We're open Monday to Friday, 8 to 4. People will call us all the time if they need us. If we're closed and they need us on a weekend or at nighttime when they're doing their dialysis, we have 24-hour, 7-day support for them to call to get some help with their machines or whatever. And we teach them all the procedures and protocols that they would follow if they're having a problem at home.
So how often would someone have to come into the clinic and I guess check in for an assessment or check in to see how things are going?
We like to see people about every 3 months. They'll come here and see their own nephrologist, and again, they'll see their own multidisciplinary team when they come. We have the nurse, the dietitian, the social worker, and the physician. They'll see each time they come.
So on average, would you serve here at the clinic?
Oh my. So we have about 55 people with our clinic that are doing peritoneal dialysis at home, and those 55 people will come about every 3 months to see us. And then we have about 10 people doing home hemo right now, and the same. They'll come and see us about 3 times or every 3 months to see us here in the clinic. So I don't have to do the math, but it's busy.
It's very busy. And so you served the Nanaimo area and
everything north of Duncan. So our patients are living as far south as Crofton.
Okay.
I think is actually Cowichan Lake. I think we have somebody in Cowichan Lake. And as far north all the way up to Port Hardy. And even over to Powell River. We have a few people in Powell River. So we have a large geographical area.
Which, and for people that live in the northern part of the island, I would think that home hemo would be a huge advantage because they don't have to, obviously travel to get their dialysis done. They do it in their home, and then every 3 months
You are right.
they would come down. Yeah.
A lot of people that are doing their dialysis at home, probably half of our patients that are coming to this clinic are living north of Courtenay.
Right.
And the closest hemodialysis clinic for them would be in Cumberland.
Right.
So we have a lot of people in Campbell River, Port Hardy, north, and west out to the west coast that would travel a fair distance to get their hemodialysis in a clinic.
Kelli-Ann, can you talk a little bit about your role at the clinic?
I'm the nurse lead in the clinic. I've been working in nephrology or kidney care for many years, all of my nursing career. I used to work in a hemodialysis clinic, and before that I worked in a kidney care clinic here in Nanaimo. And then when we opened this clinic 5 years ago, I started working here as well. We were a peritoneal dialysis clinic for the most part up until last September, and now we're also doing home hemo training for patients. So my role is the nurse lead. I also do a lot of the clinic visits with patients. I still do a lot of the training. We do have a primary nurse that does our home hemo training. Peggy is her name, but that's what I'm doing here. It's a journey, really.
It's a journey.
It's not a linear path. When you have kidney disease, sometimes you choose one specific type of dialysis or modality. You might go on to get a transplant. You might end up doing something else after that. And we do see people move through the programs.
So you get to know some of your patients pretty well over the years, I bet.
We do, and they get to know us.